one bit of endovenous surgery that still hasn't progressed really, despite all the technology we have, is just marking the phlebectomy sites. Now these are the lumpy veins, as you see, the varicose veins, and we are going to use the ultrasound to look for deeper veins inside and also to guide the surgery. But when it comes to the lumpy veins on the surface, we still need to mark these. Therefore we do the time-honoured way of standing the patient and making sure that the veins are completely full due to gravity, and we mark them with an indelible ink pen. It's very important to make sure it's a permanent ink pen before you start, because if you use a board marker and then the nurses start prepping the leg afterwards and it all washes off, you're lost. Also, as you tend to do the phlebectomies at the end of the endovenous procedure, if a bit of blood has been around and a bit of time as you're doing the endovenous work with the laser or the radiofrequency, first of all, smears across the area and you've wiped it a few times, if you haven't got a good indelible ink, then you might not be able to find the sites of the phlebectomies at the end of the procedure. What we're going to do is we're going to mark these veins, and as you can see on our patient here, these are quite big veins. Sometimes when you actually are marking the veins, it's more useful to feel. You can feel the veins being quite tense, and sometimes even when you can't quite see them on the surface, you can actually still mark the veins. So I always find that the best thing to do, make sure the patient's been standing up for at least a couple of minutes to fill them up fully, and then to mark the veins as you see them, but also as you can feel them. One of the most important things to remember as well, as far as I'm concerned, is I like to make sure that all the marks are continuous, so you can see the way that the vein is actually running. Some people just use little X's or little dashes. The problem with that is when the patient is lying down and you're operating on them and the varicosities have disappeared, if you've just got little marks and one or two get rubbed away, then you're not quite sure which direction the vein was going in. As you can see, these are typical varicosities of the anterior accessory saphenous vein, and this patient has got incompetence of the great saphenous vein and anterior accessory saphenous veins. So we'll be treating both of those with endovenous laser before coming back to doing these phlebectomies. Similarly, we know just from simple anatomy that when we have these obvious sites, there are places where the vein disappears and is just deep. Clearly we're not going to be using phlebectomy for those bits of vein, but quite often we do come back nowadays and we get rid of those with foam sclerotherapy post-operatively. That reduces the risk of the veins growing back again. Okay, so as we can see, that's all the marking of the front of the leg, and so now we can proceed to the endovenous surgery side.